and balance problems. Most people that have MS report that they have fallen in the past few months. And when we fall, we bruise, we strain muscles, we can break bones, we can have concussions, we can actually have a flare, make our symptoms of multiple sclerosis can become stronger. We can also then decrease our independence and we end up being more at home because we're injured and our symptoms are stronger. So the good news is that we don't have to live with these balance problems, that we can address what is causing the balance issues, and we can feel strong and stable again. My name is Pam Bartha. I was clinically diagnosed with multiple sclerosis over 30 years ago. And by the grace of God, I learned that what I was dealing with was infections, chronic infections in my body. And as I learned how to treat them, I have been able to recover and live MS-free for over 30 years now. And I've had the amazing privilege to coach hundreds of wellness champions in their recovery of not just MS, but other chronic diseases. And balance problems, poor balance, balance issues, all of these things are so common in multiple sclerosis and also other chronic diseases like different types of neurological diseases. And so we're going to talk about the causes and we're going to talk about how we can overcome these because it really is part of the recovery journey. And it's really important because it's something that limits our life tremendously. So let's look at the causes of dizziness, balance issues. We're going to start with simple things that we have to make sure that we take care of. Everything I share with you is for educational purposes only, not intended to replace the necessary measures of your healthcare provider. But what I'm going to share with you are things that you need to look into, things that you need to make sure that you're not dealing with these issues because they can be fixed and you can have balance back again and you can feel sturdy and strong again. So the first one is low blood sugar. That's a simple one to correct. Number one, infections will cause big fluctuations like our blood sugar dropping too low, but making sure we're eating enough, making sure we're not skipping meals, making sure we're eating the right foods that keep our blood sugar balanced so we're not eating a lot of processed carbs. Make sure to look into the Live Disease-Free diet. That is part of the recovery process. That diet really helps us to keep our blood sugars very steady, and that's very important in recovery. Number two is low blood pressure. This is common in people that have different types of chronic disease, and there can be various reasons for this. So are we drinking enough water? Are we having enough salt? Some of us have been told that salt is bad, so we're not getting enough good quality salt. Make sure you get Himalayan or Celtic sea salt, which has minerals in it. But salt is really important, and if we're not getting enough salt, then we definitely could have low blood pressure. Low thyroid is another reason for low blood pressure. And the infections, these chronic infections can cause low blood pressure also. And if we're taking medications, it's important to look up the mode of action, their adverse effects, because sometimes the meds we're taking can cause low blood pressure. Are we sleep deprived? This can really make us dizzy and lightheaded. And insomnia is so common when we're dealing with chronic diseases. We might have a hard time falling asleep. We might have a hard time staying asleep, waking up through the night, being up for hours. We have to use things, over-the-counter things, to help us to sleep and prepare as we're going to treat the infection. So sleep deprivation can cause us to feel really lightheaded and really dizzy and can cause the balance issues that we deal with chronic disease like MS. It can make it worse. And we talked about low thyroid. So this is really common in gut dysbiosis. So this is where we're really out of balance. We have far too many bad microbes, not enough health promoting microbes. And so that can cause thyroid issues, but we can also be deficient in iodine. So this is where it's good to make sure that we are supplementing because our diets are usually quite low in iodine. And that would be basically it. So as we're healing the gut, as we're decreasing those bad infections, the bad disease-causing microbes, and we're improving the health-promoting microbes, we notice that our thyroid function can return to normal. And of course, we support it with lots of good nutrition, including enough iodine. And then the next one I wanted to share, that another cause of dizziness and poor balance is inner ear infections. And very often, like they're at the very back where there is an area where our ears are basically linked up with our sinuses. Sometimes we can have chronic sinus infections that can impact our ears too. So we can have inner ear infections that can cause vertigo, dizziness. If you have slight pains in your ears, just make sure to have that checked, because if you do have an inner ear infection, that can cause the dizziness. So I'm talking about all the other things that we could have if we have MS also. But now I'm going to talk about the real cause of the dizziness that we suffer with when we have multiple sclerosis. So the balance issues, the balance problems. This is basically where maybe we kind of walk like we're staggered, like we've drank alcohol and we haven't, where we fall often. So this is much more than those other things I talked about. But we have to take care of them. We have to make sure we're not dealing with those, because this will help the recovery from the balance to be so much better and easier. So when we have multiple sclerosis and other diseases, so this is not just MS, and that's important to know, that we can have this movement. So it can feel like we are moving or like the room is spinning. And they feel that, the researchers feel that it's caused by a certain part of our brain becomes inflamed. So there are different parts of the brain, you can look it up later, but it's basically by the brain stem, and it's called the cerebellum. So it's kind of the very back bottom of your brain. So it's close to the where your brain and your spinal cord meet. And when that part of the brain becomes inflamed, all right, then we have issues, because that part of the brain is involved in coordination and in balance and in speech and in posture. So the important thing to know is that different parts of the brain, they have this nerve network that goes to all the different parts of the brain, and between the brain and our spinal cord and different parts of their body. So different parts of the brain, they have different roles, different jobs in the communication. So some parts of our brain might be involved in our taste and our smell and our sight, or our cognitive function, or our ability to move muscles or to move our limbs. So we're talking right now about the cerebellum, which is kind of in the back corner, bottom of the brain. And that is involved in coordination and balance and speech and posture, etc. I want to mention that this is not the only area. We're going to talk about another study at the end of this to show that there are other parts of the brain that they've found that can cause problems with balance too. But this is a very common area that will become inflamed with multiple sclerosis, but other autoimmune diseases, etc. So if you have watched my previous videos, you will know that I have shared that, number one, the central nervous system is not a sterile environment. There are many different types of microbes that can infect the central nervous system. And we talked about why. We talked about leaky gut in another video and leaky brain in another video. So I've helped you guys to understand how those critters get into the central nervous system, what kind of parasites are present. So we talked about different types of single-celled parasites like malaria, etc. There's worms, there are small flukes, there are small roundworms, there are immature forms of roundworms and tapeworms that can get into the central nervous system. We know that fungi can get into the central nervous system. Different types of bacteria, like the Lyme infections, can get into the central nervous system. There are probably hundreds and hundreds, if not hundreds of thousands of microbes that could infect the central nervous system. And that is the problem, is that we have not, I should say our scientific community has not been really spending a lot of time in trying to identify which types of infections are causing the inflammation in our central nervous system in whatever part. So we have lesions when we have MS, and those are little pockets of infection in certain parts of our brain and spinal cord. So right now we're talking about one part of the brain, which is the cerebellum. And when we have damage or inflammation there, that really impacts our balance and our speech also. So we talked about like how the central nervous system is not a sterile environment. And I've also shared in a lot of other videos that when we have inflammation in the body that is present because of disease, so we have a chronic disease of some kind, then inflammation means our immune system is activated, and our immune system protects us from the enemy. And usually the enemy, very, very often, it is some type of a microbe. It could be a virus, it could be bacteria, it could be a single cell worm, it could be fungi, it could be worms, etc. So our immune system is defending us from some type of infection. That is inflammation. It's activated. There's a war going on. And so instead of trying to figure out what is the enemy in this war, we just kind of say, well, not we. Our healthcare system, the way that we treat MS is like, there's inflammation, the immune system is acting inappropriately, we need to suppress the immune system. Instead of saying, okay, our immune system defends us from infections, maybe we don't know it all. Maybe there are certain infections that we haven't identified in the central nervous system, in the cerebellum, that could be causing this inflammation, and that is the case. We'll talk more about why I know that. So we talked about the different types of parasites, and there can be many different types. I think the biggest factor is that when we have a disease like multiple sclerosis or other neurological diseases, it's really, where are these parasites hanging out? Where are they causing the inflammation? That is where our immune system is fighting them. And whatever nerves are in that area that are becoming inflamed and being damaged, then whatever those nerves are responsible, whatever function they're responsible for carrying messages from our body to our brain, that will be impaired. And that's what we see. So again, specific nerves have specific functions, and I mentioned that they're involved in different things, different functions in our body. And so when the nerves in the cerebellum that are involved in coordination and balance, when they become inflamed, we can expect impairment, or we can expect that the balance and coordination will be negatively impacted. And the more inflammation we have, the greater the war. So the more that our immune system struggles, then the more impact we will have on our balance and our coordination. Ataxia is one of the names they call this balance and uncoordination in multiple sclerosis, but also in other diseases like different types of autoimmune disease and different types of cancers, celiac disease. So there are a lot of different diseases where balance and loss of coordination are present. Important to know, it's not just an MS thing. And research shows, the very little research that they've looked into, of course, they blame it on viruses. Everything is blamed on viruses. And it's not that viruses could not be a problem, but viruses are not living. They're not alive. They don't need food. So when we decrease the carbs, when we change our diet, it shouldn't make any difference to the viruses. And it does. So that leads me to believe that there are other types of parasites that are causing the problem. Things that like sugar and carbs, like bacteria and fungi and parasites, single-celled, small parasites, immature forms of worms, the immature form of tapeworm, the immature form of roundworms, small filarial roundworms. So all of these different microbes, they thrive. That's their favorite food, is carbohydrates and sugar. So when we eat a lot of that, then we can notice a lot of symptoms getting worse, including balance. So that's why I don't believe that viruses are really the biggest cause of, like, the biggest type of infection that's causing the poor balance. So if you like what you're learning, and if you want this to get out, please help me to share this by sharing this video, liking it. Other people will see it. We can get discussions going into the infection realm so that we can start to treat the cause. We want to get more and more people asking their practitioner, like, what about infection? And you can take everything that I've shared. You can take the studies, just educate yourself. This is the only way things are going to change. So back onto the notes here. Type your questions in the question box. I will answer them at the end. So that's why I don't believe that viruses are really the biggest culprits, is because they are not living. It doesn't matter what you eat. They could be more active in us, and they could impact our immune strength if our immune system is dealing with more and more different types of infections. But in our students, in the Wellness Champion students, as we decrease the carbs, we're still eating lots of healthy vegetables. It's a super healthy diet, the Live Disease-Free diet. But we see improvements in balance. We see improvement in coordination. We see improvements in many different things. So that is why I believe that there are other microbes. And as we're treating the parasites, the fungus, and the bacteria, people recover. We haven't been treating any viruses. We haven't been, other than things like maybe garlic is antiviral, or some of the oxidizing agents, oxygen type therapies, they could be treating all kinds of different organisms. But really, the vast majority of the treatments that our wellness champions have been using to recover from chronic diseases like MS, they are antibacterial, antifungal, and anti-worm, anti-amoeba, etc., and also anti-protozoa, like the single-cell parasites. So that's what's helping people to recover. A little study that I just grabbed just before I went on here, and it's called Vertigo and Imbalance Caused by a Small Lesion in the Anterior Insula. So that is a different part of the brain. So that is not the cerebellum, which is, and so this is where I want you to think and understand that very often in science and in medicine, in our healthcare, the way we treat, it's like, oh, our immune system has just gone haywire, or this part of the brain is where all the coordination and all the balance happens. It's like our body is so amazing. It is intelligently designed. It is so complex. When I was in university many years ago, my cell biology teacher, he said, what I'm teaching you is what we know right now. And we're learning so much all the time. And that is an honest professor. And that is the case for this too, is that it could be, just as this one study showed, that there are different places in the brain that can impact our balance and our coordination also, but it's still the same theme. It's a lesion. It's something that's getting in there, causing our immune system to fight. There's a war going on. Those nerves are becoming inflamed. And instead of shutting our immune system down, why don't we figure out what it is and treat that critter, treat that type of microbe, that infection that's there? And that gives us our life back. That gives us our balance back. We can feel strong. We can feel steady and stable again. And that is the key. And it's a bit challenging to try to figure it out because we don't have good tests. But it's not impossible, and our wellness champions are doing it all the time. We have to knock back bad bacteria. We have, usually when we're really sick with serious chronic diseases like PLS, MS, ALS, cancer, we're really out of balance. We have severe dysbiosis. So we can pretty much guarantee that we're dealing with different types of fungi infections. We're dealing with different types of bacterial infections. And I've shared lots. So watch some of my videos. We have a playlist on infections. Watch that. You'll really start to learn about what we're dealing with. And although it can be overwhelming thinking, oh my gosh, there could be 200,000 different types of worms, but it's only a few treatments that will treat them. And there's only a few treatments that are needed to treat bacteria and fungi. So as you it's like peeling layers off an onion. As you're decreasing those pathogenic disease-causing microbes that have gotten not just in our gut, but into the central nervous system, this is where we heal and improve. And another study so that first one, the vitiligo and imbalance caused by the small vertigo and imbalance caused by a small lesion in the anterior insula, describes a patient with recurrent episodes of vertigo and imbalance following a small lesion in the anterior insula, that part of the brain. And then another study that I just grabbed just before I went on also is they were talking about acute, basically ataxia in the cerebellum. So this is like it comes on strong and hard, and it is a common form in pediatric ataxia. And they found that changes in the gut microflora can impact the nervous system. Wow, isn't that interesting? So there is this highway of nerves between our intestines and our central nervous system. And so whatever happens in the gut, the types of microbes that live in the gut, they can directly impact our balance and our coordination also. And so there's many different ways. I've shared, directly or indirectly, some of the bad disease-causing microbes in our intestines. They can produce different toxins that can cause our blood-brain barrier to become leaky. And then different toxins could even possibly cause this inflammation. So whenever our immune system is fighting, it's activated, we're dealing with inflammation. It would be infection, but it could also be toxins from infections. Last week, I was talking about the microbiome of people that have relapsing remitting, but especially progressive multiple sclerosis, primary and secondary, and talking about certain types of bacteria they found, like Clostridia, that can produce really strong toxins that can cause all kinds of disease symptoms. And so whether they're involved in getting into those parts of the brain or helping for leaky gut, etc. And then there's other single cell parasites like toxoplasmosis we've talked about, and many, many others. So I hope that you start to realize that if you shift your focus from trying to manage the symptoms that we're dealing with, so like if we're dealing with balance issues or lack of coordination, speech issues, posture issues, instead of trying to suppress our immune system and trying to take all these different treatments to manage our symptoms, what if we treated the cause? What if we treated and just kind of did a little bit of digging to find out, okay, which parasites, which infections are causing the inflammation in my gut and in my central nervous system, in my brain? And as I treat them, how much recovery can I have? And we're seeing that students are having so much more recovery than they thought possible. Where I never promise full recovery, but people are starting to walk after they haven't walked for 5 or more years. Sometimes their hand has been clenched like a claw and they're able to open it and start using it again. And of course, they have to build their muscle tone back because a lot of times they haven't used those muscles for years. But the exciting thing is that we thought it was all permanent damage to the nerves, and it's not. A lot of it is still inflammation. What is inflammation is kind of like the war zone. You can settle the war zone down and you can have a lot of recovery. So I'm just going to go to your questions here, see if you guys have any questions. Hello, Aurora. Hi, Husum. Hi, Alexander. Okay, questions. Hi, Deborah. Thanks for the clapping. Hi, Alicia. Okay, so Alec, you're following the diet and you're ready to start treating. Do you have any knowledge of the treatments for those who aren't in the academy? So that's the hard thing, is that when you're treating, Alec, that you have to work with someone, because for various reasons. It doesn't have to be us. So the reason you have to work with someone is because if you just, like, you can use herbs from, and again, this is all educational purposes. I don't know anything about you. You have to check with pharmacists if you're taking you can't mix meds and drugs together. And I don't know if you have had organ transplant but for a person that is not on any meds and hasn't had any major organ transplants, or, they don't have medical apparatus. So even things like pacemakers, and you have to be really careful, right? When you're even introducing herbs. So number one, if you're using herbs, we found that just, the bottle doses, that they're usually not effective enough. Even Alec, what I found with the diet is that you've probably changed your diet a lot and it's probably helped significantly, I hope. If it hasn't, then you haven't decreased the carbs enough. But when we're supporting the wellness champions, then what we're doing is we're checking their work and making sure they're in the right target zone. So getting it low enough, that really makes the treatments work a lot better. If the students don't go low enough, then they take the treatments and they find that they don't work as well. So we want to make those infections much less active. We want the inflammation to go down. We want to have incredibly strong improvements in symptoms before we consider treating. So I'm sure I've talked about different things that, like, for example, there's things like wormwood and black walnut and cloves for treating parasites, but just taking those, you're not really going to notice any difference in neurological symptoms, unfortunately. So I can't responsibly, and even, staying on social media, I cannot talk specifically about treatments because people can get hurt. So work with someone, whether it's a naturopath, whether it's us we have got the academy, we've got the action plan. We are probably going to be rolling out something else to help people that are not as sick, that just need to, just want to deal with very small issues. So just keep your eyes open for that. But it is unfortunate. Like, we are working at getting doctors on board. So it is going to take time. But what I would do, like, to recover, is just like saying, well, I can't afford to see my doctor. Like, you're going to have to get help in the treatment part. Everyone does, because that's the only way you're going to effectively recover. Hi, Vanessa. Hi, Sarah. You can't wait for your local MS Society to watch this. Don't hold your breath. Serapha. I wish, maybe it's different. I haven't been involved with the MS Society for a while, but back in the day when I was early on, when I was diagnosed and I would go to their events, the entire, like, they would have a special event and they'd have different doctors talking. And you'd go there and you'd sit down and they would say, okay, and they first serve coffee with sugar and cookies and Nanaimo bars, just all the food that would make MS patients much sicker. And then you sit down and you listen, and they'll say, you take this drug for your depression, you take this blood drug for your incontinence, your bladder, your bowels, you take this drug for your pain, you take this drug for the MS. And I literally went up to the professor, the guy who was doing the talk at the end. I said, do you really believe that the only thing there is for MS is just drugs for every single symptom? Like, do you not feel that there's anything else out there? And he just kind of looked stunned at me. And so I really disconnected. I mean, I did do several presentations of sharing this, and we've had students join from that. It really depends on who is in charge in your local city. Are they really open-minded with integrative health? Or much, because the pharmaceutical companies have been supporting them, the MS Society, for years. That's the truth. So they have basically been promoting the MS drugs, and they haven't been doing a whole lot. And so a lot of people have kind of not been following them. Maybe things have changed recently. You can let me know if they're much more open to diet, and if they're much more open to, looking for the cause, right? That's the important thing. Unfortunately, there is no money in treating parasites. So the newer MS drugs are $100,000 a year plus. And, if they were going to help you with a doctor to treat parasites, it might cost, a couple $1,000s, $3,000 with drugs and working with doctors and specialists, etc. And you're done. And it's like, adios, see you later, and you're back to life. So it would really kill the MS industry. And that's the unfortunate part. So hi, Alicia. Why is it that doctors don't believe in diets? You've asked yours and he doesn't know anything about diet research. So that is really unfortunate. So today, our healthcare professionals are, when they go to medical school, they receive very little to no information or schooling in anything integrative, especially diet. So at this point in time, our doctors are like, they have to go outside of their training to learn this, and they're really busy. So they've spent many, many years and hundreds of thousands of dollars, or at least 100 or more, in training. So they've been trained up in a way that they are the expert. The only answer are pharmaceuticals, disease modifying drugs for MS. There's no other answers in the world. And they are the ones that know that. So, and then they are also compensated for prescribing them. So some of them make a very good extra source of income prescribing these drugs. And that is, to me, a conflict of interest. So unfortunately, our doctors have not been trained in it, and they've actually been discouraged that this is not scientific. There's no evidence of this. And so they don't bother looking, because you've been conditioned for so many years to believe something, then you just believe it. Us humans we're really like sheep. We're easily conditioned. So unfortunately, you go to your doctor to be assessed, for sure, to see where you're at. But really, like, all of working with in the standard of care is so that you can get a diagnosis, so that they know what drugs to prescribe for you. If you're not happy with those drugs, if you don't feel that that is the answer, then that's not where you go for recovering. And so that's what we help people do in the Live Disease Free Academy, but you can find other people too. So the key is to shift your focus. So early on, that's why I've had so much success. At 28, I was diagnosed with MS. And I learned early on that MS was caused by infection. So I decided to take a different path. I did not follow standard of care. And that is why I have been able to live over 30 years MS free. And it's not that I've never had another parasite. And it's not even that I treated the parasites well enough early on because I didn't know how. But it's this, you just learn how, and this is the most important skill you, not the most, but one of the most important skills that you can have is to learn how to manage the microbes in your body, how to get the bad microbes, the population of them down, how to build the population of the good microbes up, and how to manage that through life. So yes, diet is important, exercise and nurturing your soul and balance and activity, all those things are important. But if your microbes are out of balance, and that is why we're out of balance in the gut, moves into the blood, moves into the central nervous system, and then into the cerebellum, and then we end up with coordination and balance issues and speech issues, and then they move into different parts of the body, and we end up with mobility, cognitive function, impairment, etc. So the solution is it's important to eat healthy and exercise, absolutely, but we have to treat the infections that are causing this issue. And that is the problem. So our doctors at this time, they are pharmaceutical representatives, unfortunately. Love them, and we need them for certain things, absolutely. I'm not trying to knock it. Like for certain things, like if you get in a car accident, they will put you back together. They're amazing at it. So crisis intervention, they do a really great job. But for chronic disease, all we have are the immunosuppressive drugs, and that is not acceptable. It's not acceptable that we are not looking like crazy to see what kind of infections are causing this inflammation in the brain, in the different parts of the brain. And I've done videos on the MRI, and I've done videos on the spinal tap or lumbar puncture and what they're looking for. They're looking for things to do with our immune system. So again, it's all, what is your immune system there for? It's there to treat infections. And whenever we have inflammation, and even this, I was listening to another topic, mast cell activation disorder. This is another thing, mast cell activation disorder. This drives me nuts. It's like our mast cells are part of our immune system. They're part of the innate immune system. They're involved also with multiple sclerosis too. And, some people benefit from taking antihistamines, etc. MS, not, again, this is educational purposes. And it's like, well, our mast cells, they're just haywire. It's like, well, do you think maybe it's that we haven't figured out which infections are activating them? Maybe that's what it is. And that's exactly what we see in our students, because when you treat the infections well enough, the mast cell settle down, all the immune cells settle down. So they're just needing some help, right? The war is out of control, and the immune system needs support, not like, oh, it's stupid, it's gone haywire, we need to shut it down. Hi, Fawn. Exactly. Thank you so much for your kind words, Fawn. Yes, unfortunately, but that's what they've been trained in, right? And so that's, if you like those drugs, that's where you go. If you don't, then that's not where you go. I mean, you can go to get your diagnosis, you can go to be assessed, but that is not where you go to get well. Thank you so much for sharing the video, Fawn. I really appreciate it. You are a wellness champion. We've got lots of wellness champions, and that's the only way things are going to change. I can't do this by myself. Hi, Jules. Hi, Ayala. So when can I start the program? Desperate, you have MS. So watch my masterclass training. I just see there's a few more questions here. I'll answer just a couple more. But basically, if you have just found me, and if this makes a lot of sense to you that infections are causing your balance, your lack of coordination, maybe you haven't been diagnosed. Maybe you're starting to get scary symptoms and you're suspecting multiple sclerosis. Then watch my videos on YouTube, Live Disease Free. Subscribe if you want to know when I'm going live with trainings, and learn about the infections. Start to change your diet. Follow the Live Disease Free diet. Decrease the carbs. Start to see that the symptoms start to improve, and you'll be like, oh, wow, she's right. And as you learn more about what you've been through, watch my masterclass training, because it'll really help you to see like how you got to this place with chronic disease. And because there's a little survey partway through my masterclass training that you answer the questions, that you can see that if you have dysbiosis, if you are out of balance, if you have these infections, there's lots of case studies. We share all the steps that we do to recover in that also. And then if you're at the point where it's like, this makes 100% sense, I am ready to treat the infections, I don't know how, I need support, I need a game plan, then what you should do is just fill out the form and book a time to chat with me, and you can become a wellness champion. So you watch my training, and then at the end, you can fill out the form, book a time to chat with me, and you can join the academy. We will send you a link for the coach-a-thon so you can learn all about the academy before we meet. And I always meet with all the new students. I want to get to know them, what they've been through, what their health history is, answer any questions you have, and because we start this journey together, and it is life-changing. All right, so I'll go on to your questions here. So you also don't know the treatment procedure. So being on an MS disease modifying drug, it doesn't matter which one you're on. I don't tell you to come off of it. You come off of it when you're ready. In the program, I will teach you how to research the drug you're on so that you understand its mode of action, how it works in the body, and you'll understand the adverse effects. And so as you're educating yourself and you're like, okay, I really know that it's infections I'm dealing with, and the gilenia is trapping my lymphocytes in the lymph nodes, and I need my lymphocytes to protect me from other infections, then you will talk with your pharmacist and or your doctor, and you will figure out the best way when you're ready, not when I tell you to. So that you do this when you're confident. And students always do that, because you'll see that these drugs are actually dangerous. And because when we suppress parts of our immune system, then we're more susceptible to all kinds of other infections. And you'll see that because when we're on these drugs, they keep switching and switching and switching us, because you'll be on gilenya for a while, and then your lymphocytes will become dangerously low, and then they'll put you on something else. And then your B cells will become low, or you'll find that you're susceptible to this rare brain infection. Some of the disease-modifying drugs will keep our immune cells or decrease the presence of them in our central nervous system where the infections are. So then we might not just get a rare brain infection, but we can end up with tumors, etc. So when you start to learn all of this, you start to understand, no, this is not the best for me. Absolutely. But you do that when you're ready. You're very welcome, Alec. And I apologize. I don't know you. I don't know anyone here. And there is no cookie cutter treatment plan for everyone. If there was, I would write a book, but there isn't. All our students are taking different parasite drugs according to what they were exposed to. So again, when we have inflammation in the cerebellum, in the one area we talked about, there can be many other parts, but it's not necessarily that there's just one bacteria that gets into every MS person's cerebellum and causes balance issues. It could be toxoplasmosis for somebody. It could be fungi. It could be different types of bacteria. It could be a wayward larva, immature form of a tapeworm that found its way there. Again, the children with pediatric, having surgery on their intestines and finding gut flora changing. So that's why, and they don't even have MS. So that is why the treatment part is very individualized, and you've got to work with somebody. But work with somebody that talks like this, that understands that it is infections. And when you have no more carbs, it's impossible to eat zero carbs unless you are eating a carnivore diet. All the vegetables, even like salad, lettuce, broccoli, cauliflower, they all have carbs in them. It's just how much carbs are you eating per day? It is quite challenging to get the total grams of carbs between 30 to 40. Some students find 30 is the sweet spot, some people 35 to 40, but that includes fiber, sugar, carbohydrates, and starches, all of it together between 30 to 40 total grams of carbs. That's where you really start to notice symptom improvements. But you have to make sure, again, that you're not getting low blood sugar, that you're eating often, that you're increasing the healthy fats. And we are going to, I'm really close to putting together like a little short video on our website, Live Disease Free. That will be the diet guidelines. So there's a 3-minute video I created and just a 2-page condensed guideline that people can use that will go along with the videos that are on YouTube, Live Disease Free, so that you can be a little bit more accurate with your carbs, and you'll notice a lot more symptom improvement. But to recover, we still have to treat the parasites, right? But that's the first step. And it's an important step, and it doesn't cost you any money other than eating vegetables. And we do eat animal protein too. Do you believe diet helps a lot? Yes, it's the first step, Alicia. The very first step, because if you just want to pop a pill to kill these parasites, it's very challenging. It's probably that, we may not be using the best doses, and these drugs, like, whatever infections we've had in the past, very often we'll have like urinary tract infections, we'll have them recurring, etc. So the drugs are not perfect. And so as we decrease the food that they love, the carbs, that they are less active, the inflammation starts to go down, we have a lot of symptom improvements, and it makes the treatments a lot better. And then we do other things to support the body. I've talked about it in other videos. And then we start to treat. And when we're treating, we'll usually treat parasites for about 14 days. So that's worms and protists. Then we will treat different types of fungi for about 10 days. And then we will take a break week from the parasite or from the pharmaceutical treatments for parasites. And during that time, our students will usually do different types of herbs and oxidizing agents. So they're still knocking back bad bacteria, possibly Lyme if they have it, and continuing to knock back fungi, etc. But that's one treatment cycle. And if somebody is fairly newly diagnosed or not diagnosed, they just suspect they have MS or other diseases, or sorry, MS, they suspect they have MS, then they could just, they might find that they're symptom free in 3 months, but they still will treat at least a month or a couple of months after they're completely symptom free because of the biofilms, because of the, like, some worms can lay 100,000 eggs in a day, and some of the little eggs can be dormant, and spores can be dormant for a long time. So we want to make sure we give them an opportunity to hatch more and really decrease the population, because we've been infested for a long time. Well, let's see if there's any other last quick questions. So Daryl, still on the eating plan, 20 to 30 grams, starting third treatment cycle. Should you change the drug plan? That is a question for in that. So you're a wellness champion. So that's the question to send to me. I can't talk about that on here. You're a wellness champion. Stop the carbs? No, you can't fully stop the carbs. I mean, the only way you could is if you're eating meat all the time, and we don't follow a carnivore diet. We still really enjoy eating vegetables, and it's super healthy, lots of vitamins and minerals, and good fiber for the good microbes. Hi, Leah. Can benign meningioma be part of the tumors? Yes, we've actually had a couple, at least one MS student that I can recall. She had multiple sclerosis, and she had non-malignant meningioma tumor. And by eating low carb, so all tumors are, I believe, this is my personal opinion, they are all caused by certain types of infections, certain types of parasites, not necessarily always the same. And so when she was decreasing the carbs and treating all the different infections, it disappeared. It shrunk so much that the doctor said, oh, you must not have had it. And then after he said, oh, you must not have had MS, it's like, whatever. So she was happy, but that's pretty cool. So yes, we've seen other tumors shrinking. People that have MS, they definitely, many of them have had cancer before or after their MS diagnosis. So MS is not just the one disease we get. Usually if we have multiple sclerosis, in time we will have several diseases, especially if we're using the immunosuppressive disease-modifying drugs. You're very welcome, Deborah. Someone I know has MS, and she is on 29 pharmaceutical drugs. That really breaks my heart. That really, really breaks my heart. That's just awful. The last question I'm going to answer here. So Nana, what's the easiest way to determine what parasites you're infested with? So what we do is we first get ready to treat. So we're first feeling a lot better. Then the treatments are going to work better through the live disease-free diet and supporting the body. That's the prep phase. And then after that, the students will take a sample, like one dose of the commonly prescribed parasite drugs, to a practitioner. So this is the best way. They'll take a sample of the most commonly treated or used parasite drugs, fungal drugs, etc., to somebody who can do some type of energy testing. So it could be a chiropractor that does applied kinesiology. It could be a nurse practitioner that, or a naturopath or a functional medicine doctor, as long as they do some type of energy testing. And so they will take the sample and they will either put it on a plate if they're dealing with a machine, or they'll hold it into their energy field and they'll test their strength. And if it makes them stronger or balanced, then it's something that's good for them or their body needs it. And if it makes no difference, then that is what they're not going to use. And because we don't have good stool tests at this time, we don't have good blood tests, stool tests, we're not testing the central nervous system either for parasites. So we just don't have good tests. They're not going to show up. You can spend a lot of money on stool tests, on different DNA tests, and you might find certain small protists or fungi, but it's not going to tell you the ones that are causing the problem. And so it can be really expensive and not helpful at all. So that's what our students do. And we don't just go by that. We go by their health history, their symptoms, their diagnosis, and then often the energy testing, the health history of their parents. So we kind of take a whole package together of kind of that helps them to determine, for their practitioners to determine what kind of treatments they should be using, like what they're going to prescribe for treating the various types of parasites that they have. So that seems to be the most helpful. And through doing that over a couple of years, we've really started to see trends of different parasite drugs that seem to be much more helpful than others, or they're more commonly prescribed in things like MS and PLS and Parkinson's, etc., and other chronic diseases. So that's what we do. So again, if this is the first time that you've met me, and if you are really intrigued by the idea that maybe parasites, maybe there's a tangible cause for what you're dealing with, if that's the case, then watch my videos on YouTube, Live Disease Free, and subscribe and learn about the infections, start to implement the Live Disease Free diet, start to feel better. We are going to have the guidelines on our website, Live Disease Free, very soon, probably within the next week. And then learn about the infections. And if you need support, if you need guidance, if you need a step-by-step plan, then make sure to watch my masterclass training, how I have recovered and how the wellness champions have recovered from MS. And you can become a wellness champion. You can join us in the academy. That's what we do in the academy. We prepare to treat. Then I help you to build the whole game plan to access whatever treatment, whatever help you need. We're in 15 countries. Our latest student just joined us from Indonesia. Beautiful young lady. She's so young. She's just in her teens, which is really sad to have MS so young. But we're helping students all over the world, and she'll be able to access whatever she needs. So with that, I'm going to let you guys go, and we will talk to you next time. Take care and bye-bye for now.